Hi, today we're going to talk about your palatal expander. A palatal expander is going to be turned once a day for 4 weeks. And so Ainsley here has an expander already in her mouth. Once it's glued in, we're going to show you how to turn from the front to the back. It does turn quite like a carousel. So when you put the key in, you will turn to the back and then release the key toward the back of the throat. And I'll give you an example of how to do that. There's a bend in the wire that we're going to insert into the hole, and that bend keeps you from pushing it too far in, but you're going to find the hole with the key, which is right in the center, and gently let it drop into place. Now you notice this can move up and down, but it's not doing anything yet, but I can let go of it and know that it's in the hole. We're going to now push down and back, and you'll start to see the Ferris wheel right here turning. So now I can see the next hole is ready for tomorrow night. Now if I unturn it this way to get it out, I've just undone the turn for the night, and I don't want to do that. So I'm going to put it back in, rotate it to the back till I see the next hole, ask the patient to open wide and gently let it drop down and back to come out. When you have this appliance, I'm going to demonstrate on Ainsley how important it is to get food out from under this appliance. And so we recommend that the parents brush for the kids at night by brushing the inside and all around the appliance underneath. And if they feel like they're gagging a little bit, you can always do the salt trick. Put a little bit of salt on the back of their tongue, and that will keep them from feeling like they're gagging. But I'm getting above and underneath the appliance, and when you go to the side, you actually have to brush the gums around the top of the band to make sure that all the food gets out from underneath it. And let the patient brush for themselves in the morning the same way. And over here on the outside of this band. So you're brushing just the gums so that the gums don't swell up around the band. We recommend that our patients turn their expander at night versus in the morning when you're less rushed. And if you do miss a night turning the expander, that's fine. You don't have to turn again the next day. Never turn 2 times in one day. In fact, if you go to a friend's house or a grandparent's house overnight, we don't recommend trying to turn it there. Sometimes it stresses out someone like that that's going to have to learn how to do it quickly and do it just one time. Just skip that night altogether, and the next night resume turning. You'll see us back in 4 weeks. If you need to reschedule that appointment for later, make sure that you stop after 4 weeks and then get in to see us, and we'll evaluate if we need to turn more or not. Also, if the band on one side or the other becomes loose in the back, if it's moving up and down on the tooth, that's not good. Just simply push that band back up on the side that's loose. Make sure you don't turn anymore till you can come in and see us and eat on the opposite side. If you call our office to schedule an appointment, you can come in the next business day. It's not an emergency if one side comes loose. But if both sides come loose and the appliance comes out, then it does become an emergency. We're available to you anytime, even night or weekend. On our voicemail is the cell phone of the employee or assistant that is on call for that weekend or night. And so you can certainly call their cell phone and find out when to come in, and they can meet you here at the office and get that glued back in for you. Since this appliance is in the roof of your mouth and covers the area where the tongue usually touches to eat and swallow, it's going to be a little bit challenging the first few days learning again how to swallow and eat with this in the roof of your mouth. So just excuse any funny sounds that you may make the first few days, but you do get used to it over time. One thing to expect, we like for you to know what to look out for and what's normal, is that there may be a little imprint on your tongue of what the appliance looks like, because you do swallow 1,000 to 3,000 times a day and your tongue's going up. So it's very normal to have that imprint on the tongue. That will go away after the appliance is removed. The other thing that you will notice is a small gap sometimes forms between the front 2 teeth, because the expander is a palatal expander or an orthopedic expander that's actually opening up the roof of the mouth front to back. So that means progress is happening, and that's totally normal. When the expansion is complete, the gap usually resumes and closes on its own without us having to even do anything to close it. So rest assured that that will go away.